lot to talk about. If you, I think we calculated 40 minutes. If it would take a bit longer, please do so. And if some people need to leave the webinar and still have a question, if you can drop it in the chat, I will make sure that Hester covers that. Okay, so the floor is yours.
Okay, thank you, Olga, and thank you also to Dave, who is not here today, for inviting me to give this this year's webinar. For me, it's the first webinar I give. I prefer to have presentations live, but well, I do my best, and I hope everything also with the presentation works. I have the honor today to speak to you about the care of geriatric wild animals in captivity. Animals in our care are getting older than their wild relatives, because conditions in captivity have improved over the years. Think of the lack of predators, improved nutrition, improved health, and healthcare and facility design also. Free living wild animals rarely live long enough to show any degenerative signs of aging, but we do in wild animals in captivity, so we see that in our centers. It's our responsibility to take good care of those aging animals with changing needs, comparable with humans who need supportive care. Unfortunately, I need my reading glasses. So a short outline of this presentation. What is aging and when do we call animals geriatric? Which physical and mental changes can we see in aging animals, and what are the potential welfare concerns related to those changes? And which specific diseases can be related to age? How can we support those aging animals by adjusting the management and care in our rescue centers and sanctuaries? Because it's not about zoos, it's about sanctuaries today. And for all aging animals, good monitoring of physical and behavior parameters is essential. I show you the monitoring that we developed at AP, so I won't go over all kind of monitorings that other people use. I show you the way that we do it at AP. For those animals who need specific care and monitoring, a treatment plan can be designed in which clear criteria for euthanasia are incorporated. So, this study from 2016, in which 50 animal species in zoos were followed, they found that more than 80% of cases, in 80% of the cases, that zoo animals live longer than their wild relatives. And this effect was most pronounced in smaller species with a faster pace of life. And you can imagine also smaller species have more predators in the wild. So they live way longer in zoos. Larger, slower species with few predators, such as elephants, live longer in the wild, so shorter in zoos. In this graph, you can see that female lions in the zoo population live longer, the brown line. It gives the age in years. They live longer than lions in the wild, the green line, and have a longer baseline annual mortality and a later onset of senescence. So with increasing age in captivity, it's important to clarify what the difference is between geriatric and aging, as both are used at the same time. We say aging animals, geriatric animals, and in human, we use the term senior, which is used when someone reaches the age of 65. So it doesn't say anything about your abilities. It's just you're a senior. The term geriatric is used for persons that are senior, but also have a fragile health. This includes a variation of the following indicators like weakness, fatigue, weight loss, or impaired balance. Oh, sorry. Go back. Aging in animals is comparable with the term senior in human and refers to animals that have reached about 75% of their lifespan in the wild. I show you later how this works. For this group of animals, we use both aging and geriatric. So in animals, it's not really a difference to use one or the other. In this study in Tricross Zoo, 33 zoo gibbons received 75 general health checks, and during more than half of these health checks, abnormalities were found. I show you. Related to age that needed treatment or adjustment. They found that from the age of 75% of longevity in the wild, animals started to show more problems. This is the yellow blocks in the graph. And health checks should be done more frequent after this age. This paper stresses the importance of doing regular health checks under sedation in geriatric animals, so that reached 75% longevity in wild, for early disease detection. So important. This can be extrapolated to other wild animal species. If you see the estimate of lifespan in the wild, so if you know that, so in this case, for chimpanzees, 40 years, in captivities, it's about 50. And if you take then 75% of the longevity in wild, you come to 30. So 30 should be the geriatric age of chimpanzees. There are publications that the geriatric age of chimpanzees is 35%, but according to this method, it should be about 30. And then if you look at the geriatric period that those animals still can live, that's quite long. For chimpanzees, that's about 20 years. So for 20 years, we take care of geriatric chimpanzees. Tigers is a bit a shorter time, but still it can be 9 years that we have to take care of geriatric animals. For the ones that I marked yellow, it's a bit different because the longevity in the wild is quite short, but there is a lot of impact of predation, or for raccoons, for instance, road incidents or things like that. Our goal should be to maintain good welfare of those aging wild animals in during this period that they're geriatric, especially also in the sanctuaries. We have to look at appropriate behavior, good health, good feeding, good housing, and finally, overall, this will mean good psychological and emotional experience of the animal, pleasure, comfort, and satisfaction. But how can we do this? So this is the situation at AAP. We rescue animals from different, mostly unknown backgrounds, rehabilitate them, and outplace them to zoos. Also, geriatric animals are successfully socialized and outplaced. Unfortunately, outplacement is not easy for all animals, and some stay in our care for quite some time. On the other hand, in the lower part, we have a permanent care of 19 virus-infected chimpanzees from biomedical research who will stay lifelong with us. So we take care of quite a few older animals. Often, wild animals in groups don't show symptoms until severe problems or abnormalities occur. Primates literally fall from their perch when they have problems, but before we notice that they have problems. That is why we need to be proactive and monitor our animals and adjust their care, especially when they get older. These are 2 animals that we currently have in our quarantine. We know their ages as those 2 came from a zoo background. This is the Patas monkey, Pave. She's 30 years old, quite an age. And this is Kinkayu Lauka. She's 31 years old. For us, it's often a challenge to determine the age of our animals. In most cases, they have unknown backgrounds and medical histories. Often care at their origin was not suitable for the species and was very poor. Animals are rescued with multiple physical and psychological problems, like deformed bones, fractured teeth, removed or cut teeth in lions or tigers. They come from small, tiny enclosures with lack of sunlight and deficient diet, and they show abnormal behavior, like automutilation. So it's possible that we estimate their age sometimes much higher than it actually is, because they're poor condition. You can imagine that it's sometimes difficult to estimate the age of those traumatized animals based on dental wear, physical characteristics, and medical history is often lacking. And when there are papers, like CITES papers, most of the time, or so in some cases, they are messed up. So they use CITES papers from animals that had died already, long time before, and they use them for younger animals. So it's difficult sometimes to determine the age of the animals that we get in. Next one. Some animals come from circuses where they had quite a tough life. Often they are already very old before they arrive in our centers. That's often happening with the big cats that we rescue in prima domus. You can imagine that the care in those animals is intensive already at younger age. So the level of veterinary care of animals in rescue centers compared to those in zoo is not always comparable. At AAP, for instance, we sedate every animal at least 3 times in their first year. And after that time, so after the first year, every 3 years. And we monitor their physical health, we make x-rays, we check the teeth, we do cardiac ultrasounds and do blood work. And not only when they reach a geriatric age, as often done only in zoos, we do this every 3 years. This care can get more intensive in aging animals. Okay, so now we know when we can call animals geriatric or aging and how challenging it is to estimate this period for rescued animals. But what is the effect of aging to the physical and mental status of the animals? And what diseases can be associated with advanced age? We first will look at the physical changes, clearly visible here in chimpanzee Maria and Sony, 13 years old at this picture and 31 years old. You see the differences? Aging is a natural process. Aging is the wearing of cells and causes a so-called degenerative disease. This involves progressive deterioration and loss of function in cells, tissues, or organs over time. So the changes are not caused by infection or trauma, but just by wearing of the cells. This can cause different features. So first, we look at body mass and composition. This is Freddy, a chimpanzee. Unfortunately, he died a few years ago. But in Freddy, you can see loss of muscle mass, fat tissue, loss of muscle mass and loss of fat tissue related to decreased caloric intake, decreased food intake, and underlying medical problems. Freddy had arthrosis. And this, next one, is Anna. She looks quite different, but she's also quite old. She also has loss of muscle mass, but increase of fat tissue related to increase of caloric intake and reduced activity. Anna has higher risk of developing diabetes mellitus and osteoarthritis. So both of those chimpanzees are aging, but have different features. And how can we help those animals? We can restore muscle mass by stimulating their activity, by adjusting the diet, and by regular monitoring of body condition score and body weight. Other physical changes are dental changes. All aging animals show erosion and wear of teeth. This is often used to determine their age. We see caries and gingivitis, which finally turn into abscesses or fistula. In rodents, dental wear is important as teeth continue to grow lifelong. Abnormal wear can cause increased pressure on the crowns of the teeth and more pressure on the roots that are pushed upwards. I'll show you the X-ray of this DGU. You can see with the red arrows where the roots of the molars, they enter the nasal cavity in the upper jaw and they come popping out of the lower jaw on the downside. This is a very painful condition. Animals stop eating. Symptoms of dental problems are, not eating, dropping food, chewing on one side, and losing weight. Important to perform regular health checks under sedation, especially in older animals, or train animals to open their mouth. Animals with dental problems need dental treatment, and food can be adjusted by offering more variety or different items to choose from or easy to chew. When animals start to lose weight or condition, that's a body condition weight below 5, this could be a sign of dental disease. So here you see a big jar of chow powder. This is what's left over in the bags of the chow of the primates. We use this chow to prepare chow balls for those that can't chew properly, so with poor teeth or extracted teeth. And on the other side, you see at the primate department, we have this cooker. So we can cook the sweet potato to make it a bit softer and more palatable. We also see dental problems like in this sugar glider misses the lower incisors. We don't know why he misses them, but it's a she. She can't chew properly. So these animals need to eat insects. So we have to squeeze the inside of the morio worms out of the worms and feed them like this. And this is something that we did in the quarantine, but now she has to start eating by herself. So we're monitoring her weight to see if she can catch up with this, or otherwise she needs to be euthanized. Oh, so here you see her eating. Another physical change that we see regularly in animals with longer lifespan are sight problems. Cataract is the age-related protein breakdown in the eye's lens, which makes it cloudy. You can see it here in Fifi, the white dot in the lens. Diabetes mellitus increases the risk of developing cataracts. In severe cases, animals only see shadows and get problems finding food and can get very insecure. So this is Fifi when she was captured from a castle in France when she was 85 kilograms. So she was also probably having diabetes at that time. She developed cataract within a few years, making her practically blind. She lost weight, was very insecure, and even worse, she lost her dominant position in the group. And in her case, we were very lucky that there were two ophthalmologists who wanted to do a cataract surgery. She got two new lenses, in one eye for close sight and on the other for far sight. And after the surgery, she recovered well and gained back her dominant position in the group. So this is Fifi for the first time seeing a piece of grass again and examining it. Not all animals are so lucky that we can give them new lenses. So those animals, we need support to give supportive treatment, and we can adjust the housing. And of course, we have to monitor them well for their physical abilities. This is Karakokoki. I will start the movie. Who arrived at Aap in 22. He has an irregular gait. Maybe you see it when he starts walking. And if you look well, you see a limp. He's falling on the left hind leg and on the right front leg. So when we made x-rays, he appeared to have arthrosis in the left elbow and in the right hip. So this is the next physical changes that I want to discuss, the musculoskeletal abnormalities. We frequently see joint problems in our big cats, like in the elbows, knees, and hips. And in our aging primates, arthrosis in the hips and knees, and spondylosis of vertebral column, and also bursitis. Arthrosis or osteoarthritis is a disease of the entire joint, including bone, cartilage, ligaments, fat, and the tissue lining the joint. Osteoarthritis can degrade cartilage, change bone shape, and cause inflammation, resulting in pain, stiffness, and loss of mobility. Symptoms that we can see in our animals are impaired movement, limping, stiff walking, and also licking affected areas. We see that in our lions. They lick the places where the joints are affected, and probably because it's painful. And what can we do to support those animals? We can adjust housing, give pain medication, make diet changes to make them lose weight, or supplements like omega-3 fatty acids, and help them to lose weight. And of course, good monitoring, I showed later, is important. This is chimpanzee Fritz. He unfortunately died a few years ago. He showed sudden onset of limping and severe stiffness. We made x-rays of multiple joints, and especially his hands and his knees showed severe arthritic changes and in the knee, you can see in the x-ray above, you can see even an articular mouse, like a small piece of bone that's causing a lot of pain. The animal didn't respond well to different forms of pain therapy and changes in the environment, and we decided to euthanize him already within a short period of only 2 weeks of time. At pathology, the changes were very clear. The joint was very dry, the cartilage was thin with multiple erosions. This is in the knee, the picture. And flattening of underlying bone. This is a very painful condition. And in humans, you would give them a new knee. Unfortunately, that was not possible for him. And this is picked up macaque Piep. She was rescued with very severe bended bones. You see them on the x-ray. This is bursitis or rickets. It's caused by a deficiency in vitamin D or calcium and lack of sun exposure, UVB light, which prevents the body from absorbing calcium and phosphorus needed for strong bones. With a good diet, the bone density can recover, but the long bones stay curved in the case of Piep. The bones in the joint don't articulate well anymore, and that gives movements in the joint, also causing arthrosis. So here you see very severe deforming arthrosis in the knees of Piep. We regularly see rhachitis in primates kept inside in small cages on a deficient diet, so lacking of vitamin D and calcium. And currently we rescue a lot of servals with rhachitis because their owners were told by breeders to feed them chicken fillet. So only the fillet, not a full prey or not a full bird with feathers, with skin, bones, and organs, where all the vitamins are. Also, very frequently, we see in primates spondylosis. It's a form of arthrosis. Let me see. Yeah, here you see it. It's a condition that usually develops with age and is the result of normal wear and tear on both the soft structures and bones that make up the spine. This can cause the disc to dehydrate and shrink, causing mobility and irritation in the joints, and bone spurs in an attempt are developed. You can see the bone spurs here. Do you see my arrow? Oh, I don't have an arrow. But you see the bone spurs where the red arrows are. And they are formed to attempt to strengthen the area of the back. And if those bone spurs, they grow together, that's called bridging or deforming spondylosis. Spondylosis in primates is primarily caused by cumulative joint disease, aging, and leading to the wear and tear on vertebrae and discs. And we also see it combined with diet deficiencies like rickets, like you see before. These are green monkeys, Xika and Zia. Both have multiple problems related to their age, and this is how we adjusted their enclosure to keep them mobile, to stimulate activity, and so that they can move around and get to their soft food, because they have multiple problems. They also have very poor teeth. I think Xia doesn't have any teeth left. She has arthrosis in both hips, and they also both have spondylosis deformans. So those adjustments, they give them some support to move around and be social. These are adjustments that we made in the enclosure of chimpanzee Freddy. Oh, I have to start it. Our caretakers are very creative with fire hoses, as you can see, and they can create hammocks, swings, bridges. And here you can see Freddy, who arrived at IPE with severe arthrosis, very poor muscles. And you see that he's nearly able to use his hind legs. But he's used like this. He arrived like this at IPE, and he still lived with us for 15 years. And I show you him also. I show some results of monitoring of him later. This is an enclosure of Koki, the caracal who I showed you before. You can see that he really nicely can move around with those bridges, extra steps. And so his mobility is quite good, and he can move around in the enclosure. This is a platform for big cats. And this is a sleeping spot for big cats. I just go fast. Now we come to the behavior changes that we can see, the psychological changes in animals that are aging. So those are just natural changes. These are still not the diseases. Similar as in aging humans, the sleep-wake rhythm of aging animals can change. They may spend more time awake during their typical sleep time, or engage in shorter bouts of sleep at varied times throughout the day. And some night animals can suddenly be awake during the day, and vice versa. We all know a restful sleep is important for physical and psychological well-being. The physical changes, as set out before, can have effect on the activity, the time foraging, playing, and also in hygienic care. And bit by bit, an animal engages less with it and its environment. Decreased inactivity results in less social interactions due to change of social status, increase of aggression. Sometimes animals get frustrated because they're getting slower, or because they have pain, or they get very insecure or anxious. For instance, with Fifi, with the cataract. As I explained with the previous physical changes, aging is the wearing of cells and causes so-called degenerative changes. This affects all tissues and also the brain. So also the cognitive and behavior changes can be seen. So here you can see, oops, Pip again. She's totally in her own in her own world, and she shows stereotypic behavior, rubbing herself with a stick. In some cases, physical and psychological problems are clear, but in most wild animals, it's very difficult to pick them up as they develop gradually. And a complicating factor in wild animals is that they mask their pain or vulnerability as they don't want to lose their position in the group. So when you see problems, they are more severe than you think they are. Like I said before, some primates just fall off their perch. It's good to be aware that the social abilities of aging animals can be reduced. Aged animals are often rescued alone, and when it is a social species, it's important to socialize it to conspecifics again. For older animals, it can be challenging as their natural social skills can be very poor. And we tend to form groups with older and younger animals mixed so that they can support each other. We also can help animals, aging animals, by making changes to the enclosure, have multiple platforms, spots out of sight, and so that they can get away with group members, and to distribute food over multiple places, to have enough enrichment that all animals can reach it, and adjust the training routine for animals that are slower in movements, but also in learning. So when you train the animals, it takes more time, and the caretaker have to be more patient. Some animals might need behavioral treatment when they are, for instance, very aggressive, anxious, or showing abnormal behavior. So those can be antidepressive or antipsychotic drugs. And again, good monitoring is crucial to follow up the effect of those changes that are made. So now we come to the age-related diseases. Animals experience health problems, and those should be monitored. So you have to sedate animals at a specific frequency to monitor their for cardiovascular health, for kidney failure, for diabetes. Those are things that you don't just see from the animals. You really have to sedate them and do diagnostic checks. I will go over the most common age-related diseases, cardiovascular disease and kidney failure, because I have a bit of lack of time. So cardiovascular disease is very common in great apes in captivity. In our rescued and laboratory chimpanzees, 74% of animals that died had a post-mortem with one form of cardiovascular abnormality. In zoos, this is about 50%, so still very high. And probably the percentage is higher in rescued animals because of the higher amount of stress and trauma that the animals experienced. Most common in chimpanzees is cardiomyopathy, and then more specifically, idiopathic myocardial fibrosis. So myocardial fibrosis is a non-specific response to, I gave it away already, to injury and exertion of the cardiac muscle. Interestingly, in sanctuary house chimps in Africa, no cardiomyopathy was found. So it seems to be related to stress, to trauma, to hard life, maybe to a deficient diet. And in smaller primates, we mainly see valve disease, so of the valves, and those are more prominent. So no cardiomyopathy. Symptoms of cardiovascular disease are visible with more advanced disease. So you don't see it in the initial stage. We can see sudden deaths, syncopes like fainting. You can see edema, coughing, or high blood pressure. And it's important to diagnose cardiovascular disease before symptoms occur. So during sedations, you have to check blood pressure, cardiac biomarkers. So those are the proteins that are released when heart muscle cells are damaged, so you can show them in the blood. And we have to make an echocardiogram. How can we prevent or treat those diseases? Is of course, with heart medication, adjust husbandry and care to make it easier for the animal to avoid physical exertion, and monitor those symptoms for deterioration. So here you can see the heart of chimpanzee Noah. He was 40 years old. He died this spring. He has very large and dilated ventricles, so the lower chambers, and atria with tenting of the valves. Oh, I don't see it anymore. It's not moving anymore. Sorry. And we started him on treatment, and he lived for quite a long while after the first diagnosis was made. But finally, he died of this condition. So the next disease is kidney disease, very prevalent in big cats, also smaller cats, but we mainly have in our rescue center the big cats, the lions and tigers. And it's an irreversible and progressive condition involving structural and functional abnormalities in one or both of the kidneys. Chronic kidney disease is a result of aging and sometimes related to inherited conditions like polycystic kidney disease, also common in domestic cats, infections, or hypertension. Chronic kidney disease is common in aging big cats, also seen in many other aging cats. So about 8% of cats over 15 years have mild to severe chronic kidney disease. So a common condition. Symptoms are visible when 70% of kidneys are affected. We can see polyuria, polydipsia, weight loss, and nausea and vomiting in very advanced stages. We can diagnose or monitor by looking at kidney values in the blood. We can look at protein, it's called the UPC, the urine protein creatinine ratio in the urine. Of course, weight monitoring is important, and the relation of blood pressure and kidney disease is common. So also the monitoring of blood pressure is important. Supportive treatment is possible for kidney disease. We can't cure it, but we can give high quality proteins, so preferably white meat over red meat. If possible, plant-based proteins. We have to increase water intake. We can give medication like ACE inhibitors to stimulate the flow of the kidneys. And again, chronic kidney disease monitoring is important. So we've seen the diseases, we saw all the physical changes in aging animals, and now we come to the chapter of the management and care of those animals. What can we do to support those animals? I already showed you some examples of adjusted housing, like steps and bridges, platforms, feeding places, easy to reach. And to support animals with musculoskeletal problems, with behavior or mental issues, with sight problems, with cataract, and to create a safe but challenging environment to keep the animals motivated and active when they have more mental issues. And diet adaptations that we can make. We can give high quality proteins for muscle strength and for animals with chronic kidney disease, a variation of size and textures in animals with dental issues. We can give supplements like vitamin D and calcium in winter for primates to promote overall bone health, but also overall health. And it's good to check vitamin D in the blood when you have a primate under sedation to check if the level is good, or if they need maybe vitamin D also in summer. You could give, we don't do it at the moment, but you could give omega fatty acids, and then especially omega-3 in animals with arthritis. This helps to improve inflammation, and also it helps for animals with behavior issues to support cognitive function. And we can adjust enrichment. We can make it more accessible, so offer it horizontal rather than vertical, offer lower options, make it safe also for dental trauma, and make enough so that also the slower animals and the older animals in the group can get sufficient enrichment as well. So here are some examples of enrichment. The aim for these enrichment items is to motivate the animals to show more natural behavior and fulfill their needs, for example, with regards to exploring, foraging, and playing. More management and care specifically for aging animals is to do preventive health checks. I already stressed the importance of it. Some health-related issues are not visible, and we just have to check. We have to weigh the animals, of course. We look at body condition score. And when we handle the animals, when we sedate them, we evaluate, of course, anesthetic risks, always before the sedations. We check their teeth, take blood samples. We look for cardiac biomarkers, kidney markers, and vitamin D. Then we can give supportive medication. Here are some pieces of bread that are offered daily to our primates with arthrosis. They contain meloxicam, and they get it daily. And it's better to give meloxicam. Some people say meloxicam is bad for the kidneys, and you shouldn't give it too long. But it's better to give it and have those side effects than animals to be in pain, to live in pain. And then we can do positive reinforcement training for weighing, presenting body parts, to give hand injections, to take urine samples or even blood samples, and to do diagnostic exams. I show you some examples. This is Marmoset Coin. He's weighed once a week. He's one of our animals that is having or is prone to marmoset wasting disease. So his weight is quite an issue. But we weigh most of our geriatric marmosets because it gives a good idea how they're doing. This is the weighing of Tiger Kira. She has severe arthrosis in her elbows, and she's trained to go on the scale, sit still for weighing, go off the scale. She will do it in a few seconds. Go off the scale. Go on the scale again for a second weighing and to stand still. So very nice training done by Jolene. We can train, it's a different kind of training for urine collection. So how do we get a urine sample of Uro, who's sitting here on our island? He's 22 years old. He had urolithiasis, and he had a bladder stone and cystitis, and he's still monitored for presence of crystals in his urine. So the regular urine analysis, like once every month. You can do urine checks for chronic kidney disease to look at protein in the urine. For urolithiasis, as I showed, cystitis, also cardiac disease, the protein that you find in there, and high blood pressure. And of course, the glucose levels for diabetes mellitus. It's quite a challenge to get a fresh and clean sample from animals. So training to obtain the sample is very useful. So here you see Euro. He first gets a large amount of water. We wait a while. Then we take this spoon that Baptiste, he holds it in his hand. And then he holds it under Uro. You don't see the urine, I think, but you see the feces. It didn't end up in the spoon. But this is the way that we get a clean, fresh urine sample. And here you can see Marieke, who's training a chimp for presenting body parts and to also train for giving, here you see it, hand injection. So the hand injection can be used for quiet anesthesia, very, very easy anesthesia if you can do the injection by hand, but also to give medication in animals that refuse oral medication. And you can see in this animal that he really enjoys the training. Offering food. So in case we have to check him for wounds on the foot, on the hands, it's very easy to ask him to present the body part. Here you can see how blood pressure can be taken with a PetMap finger cuff in a bonobo. We don't do this yet at ART. This is something that we would like to do to monitor animals, the chimpanzees that we have on cardiac medication, to monitor the effect of the medication. But this is how you see that they train by putting the finger through the mesh. Another kind of monitoring is for the cardia. This is like an electrocardiogram, a small device. The animal just has to put 2 fingers on the device, and then you have this simple electrocardiogram. Of course, you have to compare it with a normal electrocardiogram with 12 leads that you do during sedation. But just to monitor the effect of your treatment, it's really nice that it's possible to do it this way. So all animals, young and old, are monitored daily by our caretakers. All are checked on a weekly basis by me or one of the other vets. And together with the caretakers, we can decide to increase weighing and scoring of body condition score. This is done once a week in geriatric marmosets and once a month in geriatric animals with multiple problems. And we can decide even on extra monitoring. So pain score monitoring, this is something that we developed this year at AP. Geriatric monitoring, heart monitoring, urine monitoring. And these kind of monitorings are all done by the caretakers. For individuals with chronic or recurrent problems, a treatment plan is developed with a description of the problem, prognosis to get to an acceptable condition, and the time that it's needed to get to an acceptable condition. Treatment options are described and criteria for monitoring is set out and clear, as smart as possible. Probably you all know the meaning of smart. And there's always a consideration to euthanasia animals. So euthanasia is always a part of the treatment plan. The monitoring of criteria is done by the caretakers, and the analysis of data and assessment of results is done by the behavioral biologists or the vets. So first, I wanted to show you how can you monitor pain in wild animals. We wanted to investigate this and to find which indicators are the best indicators to check for pain, because you can monitor a lot, but you're limited in time, and you really want to do the keepers to do this on a daily basis. And in this study, we looked at chronic pain. In humans, you can use the pain rating scale from 1 to 10, that is shown here. And in domestic animals, there are also specific pain scores developed, but we can't use them for our wild animals. And an interesting one is also for cats, the Grimace scale. And this is something that we are planning to develop for our big cats, but we don't have it yet. But yeah, there's nothing at the moment for wild animals, not a scoring system for pain. So we started a small pain study at AP. These are, I won't go over all, but these are the symptoms in animals that can be seen when they are in pain. And we wanted to develop a pain score that could be done daily by our caretakers. And we would like to focus on those indicators that are most related to pain and easy to monitor. So what we did, we looked at 12 individuals of different primate species with skeletal disorders that could cause chronic pain. We had 3 groups. Group A received glucosamine and Novacam, and during the study, first glucosamine was stopped and then Novacam. In Group B, they only received Novacam, and that was stopped after a few weeks. And in Group C, there were 2 individuals that did not receive any medication but started on Novacam. The individuals were observed for 2 weeks first with the medication, and then there was a week in between to make sure that the effect of the medication was either completely gone or fully present for the animals that started on medication. After that, medication was started or stopped again. So we, vice versa, we checked the group when they weaned off the medication, but also when they got medication again. And during this period, we observed behavior indicators. And we looked at physical abilities. We looked at walking, climbing, getting up, lying and sitting down, and posture. And for all those 5 indicators, we looked within the indicator, we looked we scored for stiffness, fluency, balance, and lameness. And the results, I just showed you the final results. The results of the studies showed that the best indicators for pain were foraging behavior, social behavior, especially aggression, stress behavior, especially scratching, abnormal behaviors, self-mutilation mainly, and activity. And the best physical indicators were walking, climbing, lying, and sitting down. And all those indicators were used for the development of a geriatric monitoring that I show you later, and a simple pain score monitoring that we set up this year. So the geriatric monitoring, it's active since 2020. And we started observing geriatric animals with chronic problems. So not all geriatric animals, but mainly the ones that showed problems or that we knew of had problems. The geriatric monitoring was also used for animals with a treatment plan as part of the monitoring for criteria in the plan. And for the 8 indicators, caretakers evaluate, did the animal do better, the same, worse, or don't know. And they compared this with the last time that the caretaker saw the animal. So it doesn't mean that the caretaker has to work every day and it was scored every day. So there could be a few days in between, but it is really a caretaker who looked, is it better, is it worse than the last time I saw the animal? This monitoring can be done once a day or sometimes a few days a week, depending on the species and the specific problem. The caretakers observe throughout the whole day and when they take care of the animals. And at the end of the day, they fill in the data in Excel. Because of the monitoring is done at regular times, this gives a lot of information about the daily changes that can be seen. And it's a relatively small investment for the caretakers per day. I hope they agree with me. So this is the Excel that they have to fill in. And this is how it looks. So for activity, they can fill in, it's worse now, it's the same, it's better, or I don't know. And then what you end up with is, this is what we did for Freddy, the chimpanzee with the very poor muscle strength and the severe arthrosis in his hips and knees. You see that in this graph that in about 2 years' time, his stiffness, locomotion, and climbing all deteriorated. And it was decided to euthanize Freddy in April 22. The downside of this scoring system is that it's not quantitative. So the steps up and down are always of similar size, even if the difference is very small or very big. So that's something that we want to work on. But still, this gives some idea of, you want to know, especially if those problems that really deteriorate very slowly, you want to monitor and want to see if it really gets worse. So this is the pain score monitoring that we set up. It monitors the effect of pain treatment in animals with arthrosis and or spondylosis. So it's not just to look at pain, but really to look at the effect of pain treatment. We give so many animals pain treatment. We really want to know if it's still effective. Is it necessary to top it up or change maybe the dose or change to another painkiller or combine painkillers? And we base this on the 5 indicators of the pain score study. Sorry. I have to go back. First, what is done is that per individual, so that's different from the geriatric monitoring, the baseline is described for all those 5 indicators. And then observations are done twice a day for about a few minutes. And data are entered at the end of the day. And the observations are performed by 2 caretakers who know the individual well. So it's not every caretaker who can do it. It's done by 2 at the moment. And for this monitoring, we use the welfare and care module in ZIMS, which is easy to use for the caretakers and gives good graphs to evaluate the effect of pain treatment or changes in pain treatment. So here you all know ZIMS, and you see the red circle. This is where you can find, I don't know why it's going up, the care and welfare module. So the indicators that we use are climbing, walking, limping, general activity, jumping, and posture. And you can see that there are 5 choices to make. There's a major decline, a minor decline, there's no change, a minor improvement, or a major improvement. And you put this in a graph, all those indicators, and it looks quite messy. You see all the lines of all the indicators in one graph, but the good thing is that you can deselect all indicators and then you also only click one. And just for this presentation, I added the blue arrows with the treatment, so you can see the changes on the changes of the indicators when also the treatments were changed. And this is Ilias, a Barbie macaque of 70 years old with severe arthrosis in both knees and bronchitis. Quite a poor condition. And monitoring was started 2 weeks before the start of Novacom. And here you can see all indicators in the graph. And if you want to see only the indicator for climbing, you can see the topping up of Novacom and also adding tramadol to the Novacom. So Novacom is meloxicam. They didn't give any improvement. You can see that this graph is different from the one of the geriatric monitoring because there's a clear description of a baseline for the animal and it's set to 0. So the graph stays within the +2 and the -2 line. It can't go much further down or up as in the geriatric monitoring. Oh. So this is for jumping, a similar profile. General activity. Again, you see that with the Novacom tramadol, there's no improvement really. And this is why finally we discussed with the care team that it was better to euthanize Ilias. But you can see that it's a very nice and simple monitoring system. As said before, for individuals with chronic or recurrent problems, a treatment plan is developed with clear descriptions of the problem, treatment, and timing. It is important to always realize that the plan is written in the interest of the animal. So think out of the perspective of the animal. A clear prognosis is set to an acceptable condition, and the time to get to this acceptable condition is also marked. Criteria for improvement or deterioration are set out and different options for monitoring those changes are ticked. So I show you the animals can get a plan when they have gradual worsening of symptoms or aging, recurrent problems, problems with poor diagnosis, behavior problems, or multiple problems. Multiple problems is mainly in geriatric animals with poor teeth, with arthrosis, so combined problems. So we have different treatment plans because it's time intensive to develop those plans. We made those standard plans for problems that we commonly see in our animals. The geriatric plan for multiple geriatric problems, arthrosis plan for big cats and primates. We made they are different because the criteria are also different. Also for chronic kidney disease, we have 2 different plans: cardiovascular problems, DIGU, dental problems, and behavior problems. And of course, we can still make an individual tailor-made plan for animals with rare or unique diagnoses. So this is an example of a treatment plan for chimpanzee Peggy that we still have. She's still in our facility. She's 32 years old and has chronic kidney disease without showing symptoms. So she has this chronic kidney disease treatment plan. She has increased kidney markers, very, very poor markers. So the creatinine and the BUN, the ureum, are very high. The protein in the urine is very high, but she doesn't have any symptoms. So here we ticked on the form her kidney problem. There's gradual worsening because we followed her urine and her urine parameters, and we see that it's getting worse over time. And also the prognosis long-term is poor. So that's why we tick this. Then here you can see that we entered the treatment. She's on enalapril, an ACE inhibitor. And how she's doing at the moment? Well, at the moment she's doing really well. She doesn't show any symptoms. She has a good weight and her body condition score is 5. And then her prognosis, at short term is quite good, but on long term is very poor with this kind of kidney disease. A human nephrologist was involved in her case and said that the human with those values would start dialysis or would be on the first on the list for kidney transplantation. So that's the situation that it is, but she doesn't show any symptoms. As she's not having any symptoms, the level of pain, so this is how we estimate is it acceptable or not. do we really proceed with this case or not? So in her case, the amount of stress or pain or discomfort is very small. So it's one. We ticked it one. And the estimated amount of time to reach this acceptable condition, well, we don't know because clinically she's fine. She's not showing pain. So we didn't tick it. So for her, we said the amount of suffering is acceptable. The type of suffering is also acceptable at this time. So we continue treatment and we monitor her 3 times a week with the geriatric monitoring. And we monitor her urine protein every 2 months. And you can see, so if the amount of suffering was 4 or 5, or the time of suffering is unacceptable, and it's difficult to determine what's acceptable and what's unacceptable. That's what the specialists do together. So if it's unacceptable, then you have to immediately go to euthanasia. So, but Peggy, she is monitored, so we can tick this animal is monitored by the daily monitoring. She's having the urine monitoring and the geriatric monitoring 3 times a week. And then in the plan, so this is specifically for the chronic kidney disease plan, we have criteria specifically for the kidney disease. So we follow up on the protein, the urea. If there's an underlying cardiovascular problem with increased blood pressure, this has to be treated within or responding to treatment within a week time. And if there are more than 3 signs of kidney failures, then also this is a criteria to start considering euthanasia. And then we also have, in all plans, we have the general criteria of euthanasia, so general features that normal, healthy animals should show. But I don't put it. So this is the geriatric monitoring of Peggy that we did. It started in March this year. At the start, there was a slight decrease in social behavior, the brown line. I don't know if it's also brown or dark red on your computers. And this was the time that she was introduced in a new group. But since then, positive social behavior even increased. And the other parameters are stable and unchanged since the introduction. So she's currently doing quite well. Sorry again. So Peggy's case is a good example of how abnormal blood values alone are not a reason to euthanize an animal. As long as her welfare is good, we are happy and she is fine. And of course, long term, her prognosis stays poor. So we decided that she stays at AAP and won't be outplaced to a zoo anymore. So that's the only downside. So in conclusion, wild animals in captivity have a longer longevity compared to their relatives in the wild. The geriatric period is particularly long for animals with a long lifespan. So at AAP, those are the apes and the primates. And even chimpanzees, the geriatric time can be up to 20 years. So this is a long time of monitoring and extra care. I showed you some physical and mental changes related to aging and some disease risks that increase with age. Adjustments that we can make in care and management are listed here. So adjustment in housing, diet, enrichment, the preventive treatments, pain relief, training, monitoring of mental and physical parameters, and the treatment plans. I think the treatment plans are really good to make for animals, especially when they show problems. And euthanasia is a treatment option, so that has to be always in our minds. The making of a treatment plan is teamwork. So involve caretakers, we always involve the behavioral specialist and the whole vet team. And when finally euthanasia is considered and done, the whole team is involved. Taking care of aging animals is challenging, intensive, time-consuming, and expensive. So you need well-trained, experienced staff. And also the management of our centers, they should be aware that taking care of those animals is not as easy as it is for a normal zoo population. It's fantastic that animals in captivity live longer, but these extra years, the welfare should be guarded well. And we aim for quality of life, not quantity. So providing animals with a high quality of life for as long as possible, that's what we aim for. I have some further reading for you, a great book, The Optimal Well-Being of Aging Wild Animals in Human Care. It's like a holistic approach with a lot of chapters about nutrition, plants, euthanasia, the ethics of the geriatric animals, keeping geriatric animals. And there's also a very nice chapter of Francis Cabana about nutrition. And there's some very interesting articles to read. So I suggest you to read it. And then I want to thank a lot of people of AAP that provided pictures and videos. And thank you all for your attention. And I hope you enjoyed it. So are there any questions?
Thank you very much, Hester. It's a lot of information and very interesting to see and get insight on how AAP is dealing with these situations and covering the monitoring and the treatments. I don't see any question in the chat. I see some clapping hands. I don't know if somebody has a question for Hester. Please feel free. No questions?
No questions?
Yeah, and it's 3 o'clock, so maybe we can leave it here.
Yeah, you have to go back to work.
Exactly. I just want to thank you, Hester. It's been really interesting. It's recorded and we'll circulate it around. Okay.
Okay,
Thanks a lot.
thank you. Thank you all. Bye-bye.
Bye-bye.